Do you find that the whites of your eyes have turned a dark yellow in color? Or is your urine very dark yellow or suddenly appearing tea colored? Then this is called jaundice or pilia or yellowing of the eyes. I'm Dr. Bhargav Raut, the Chief Pathologist at Pathofast Lab in Pune, and we perform blood tests and lab tests for a variety of problems, especially like jaundice. So, what is this yellowing of the eyes or jaundice? Normally, the red blood cells in our body have a life of just 120 days, after which they are broken down. They are normally converted into a yellow colored substance called bilirubin by your liver. This bilirubin is then mixed with water and let out into your urine. This gives your urine the normal light yellow color. But if something goes wrong in this entire pathway, for example, if too many red cells are broken down, or if your liver is infected or damaged in any way, or the outflow tract from your liver is somehow blocked, then this yellow substance begins to accumulate and pile up inside your blood and your body. And this gives this yellowing of the white of the eyes, maybe of your skin and also of your urine, which is then seen as jaundice. Before going ahead, I would also like you to check for a few other symptoms, like does your skin also have a yellowish tinge to it, or is your urine appearing like the color of tea? And lastly, do you find that your stools are looking pale or clay colored? If yes, then you definitely have multiple signs of some kind of problem in your bilirubin metabolism or jaundice, and now I'm going to tell you everything you need to know about it. The first and most common cause of jaundice is inflammation or swelling of your liver. This is called hepatitis, and it is usually caused because of viral infections as well as weight gain and too much of alcohol. One of the common signs of hepatitis is jaundice or yellowing of the eyes, together with other signs like feeling very tired, not feeling like eating, and having pain on the right side of your stomach. The tests that we do to check for any kind of infection of your liver by a virus are called tests for hepatitis viruses. In these, there are only 3 tests that are really important. That is the hepatitis A IgM blood test, which checks for the hepatitis A virus. Similarly, we have listed 2 blood tests, one for the hepatitis B virus and one for the hepatitis C virus. Last but not the least is the level of the bilirubin in your blood, which is actually giving this yellow color. So if any of these first 3 tests are positive, or the bilirubin value is above normal, then you can be certain that you have something wrong with your liver, which is causing this yellowing of your eyes. The next common cause of the yellowing of your eyes or jaundice is that there is a blockage in the pipe which goes from your liver into your intestine. This is called the bile duct, and it can get blocked for a number of reasons, like gallstones, which are small stones made up of the bile itself, a cancer which is pressing down onto the duct, and also hardening of the bile. Now all these things will cause a blockage or a backflow into the liver, similar to the way in which the plumbing of your house could get choked and then water would start coming back up. Now this also causes inflammation of the liver, and it can also give rise to the yellowing of the eyes. There are 2 blood tests that I would recommend to check whether your bile duct is blocked. One is called the alkaline phosphatase blood test, the other is called the GGT blood test. Both these are simple blood tests, and in fact they are included in the commonly called LFT or liver function test, which is just a blood test of all the enzymes related to your liver. Any elevation in either of these 2 values can point to a problem like a blockage of your bile duct. The next possible cause because of which you have this yellowing of your eyes is because your red blood cells are breaking down at a faster rate than normal. Now this can have a variety of causes, from everything from malaria to some kind of an immune problem in your body, to also having abnormal types of hemoglobin in your blood, for example thalassemia or sickle cell diseases. There's a very wide set of reasons because of which this could happen, but I'm going to give you some simple blood tests that can check whether this is even happening or not. So here are 3 blood tests that you should do, which includes the reticulocyte count, lactate dehydrogenase level and haptoglobin level. Now, any change in these values, like an increased level of haptoglobin, will point to the fact that red blood cells are breaking down faster than normal, and your doctors can then investigate the real cause of this. It's important to remember that red blood cell breakdown generally is not a good sign, and if you find any signs of these, like any abnormalities in these three tests, you should immediately consult your doctor. The next possible cause of yellowing of your eyes is basically some kind of a long-term, long-standing disease in your liver. Now, we already covered some of these causes like hepatitis B virus, hepatitis C virus, but together with this, there can also be other causes which can cause a long-term scarring and reduced function of your liver. This can include drinking for several years, as well as certain kind of metabolic disorders like hemochromatosis, where the iron is not properly metabolized in your body and gets excessively deposited in your liver. There are also several other conditions like inborn problems in the enzymes which are necessary for the bilirubin metabolism. What happens in this is that bilirubin is not properly either created or gotten rid of from your liver, and because of this also your eyes can start looking yellow. So I'm going to give you some tests that you can do to just check for this, which are all simple blood tests and are usually covered in the liver function test panel. So the alanine transaminase, that is ALT, or then the aspartate transaminase, that is AST, and the albumin, which is the main protein in your blood, are all things that are made by the liver. Elevation of the first two tests means that your liver is definitely under some kind of damage, and a reduction in the albumin will mean that your liver is not functioning properly, and so it is not able to make enough albumin. Any change in these three tests points to a definite problem in your liver, and your doctor can then investigate the actual cause. But this is usually accompanied with a yellowing of the eyes, which is what you have noticed. A final cause which could be giving you this problem is something wrong with your pancreas. Your pancreas is a small organ which is present very close to your liver in your stomach, and its job is usually to break down the proteins in your food into smaller chunks which your body can absorb. Swelling of the pancreas, or cancer in the pancreas, or pancreatitis, which is something that happens because of drinking too much, can all cause a problem which also leads to inflammation of your liver and can give you a choke up of the bile in your bile duct and then cause this kind of yellowing of your eyes. So I'm going to give you a couple of blood tests that you can do to check for this. So the direct bilirubin level, which will actually have been included in your liver function test, which we already covered, is one test you can do, but specific for your pancreas is something called the serum amylase level, which is again a simple blood test. Important to remember that you need to do this test when you are fasting for at least 8 to 12 hours. Together with this, you can also do the CA19-9 test, which checks for some kinds of cancers which can also produce this problem. So these are three simple tests that you can do to check whether your pancreas are affecting in some way the entire metabolism of the bilirubin and causing this yellowing of your eyes.